Today, we're going to delve into something truly remarkable, a medical imaging technique that lets doctors peer inside one of the most intricate systems in the human body, our vast network of blood vessels. We are talking about angiography. Okay, so imagine this. You have to find a traffic jam in a massive, sprawling highway system, but the roads are totally invisible. That is the exact challenge doctors face with our cardiovascular system. So how in the world do they draw a map? All right, let's dive in. The first step really is figuring out how to make those invisible highways just pop into view. And the solution they came up with is absolutely ingenious, and it completely changed how medicine is practiced. I mean, just look at the difference here. It's night and day. On a standard X-ray, sure, you see bone, but the blood vessels, they're soft tissue, so they just don't show up at all. But once a special contrast agent is injected, boom, the entire vascular network lights up in incredible detail. And that right there is an angiogram. And this ability, this power to create a crystal clear roadmap is what angiography is all about. It gives doctors the ability to navigate our internal highways with unbelievable precision. You know, the name itself kind of tells the whole story. Angiography comes from two Greek words, one meaning vessel and the other meaning to write. So it literally translates to writing with vessels. How cool is that? The image it creates, the angiogram, is that detailed record, that map of our vascular system. Now, this technology has been around for a while. It actually started way back in 1927 with Dr. Igas Moniz. But the real game changer, the innovation that made modern angiography possible, came in 1953 with something called the Seldinger technique. And we're definitely going to get into that in just a minute. But before we get into the nitty-gritty of the procedure, let's just take a quick tour of these highways to really understand why mapping them is so absolutely critical. Our cardiovascular system is so much more than just a bunch of plumbing. It's a dynamic, living transport network. It delivers everything our body needs to survive: oxygen, nutrients, you name it. And it hauls away all the waste. Keeping it running smoothly is, well, essential for life itself. Let's just focus on one critical area, the brain. The entire function of your brain relies on just 4 major arteries. Think about that for a second. Only 4 main supply lines for our most vital organ. And these are the names of those 4 crucial highways. So you can imagine, if you're a doctor performing what's called a cerebral angiogram, you have to navigate this incredibly complex intersection to find problems, like a dangerous blockage or an aneurysm. And what's really amazing is that at the base of the brain, these arteries all connect in a loop called the Circle of Willis. It's like a natural backup system, a traffic circle that makes sure that if one route gets compromised, blood can still find a way to get where it needs to go. Just incredible engineering. Okay, so how do doctors actually get inside this complex system to inject the dye and create that roadmap? This is where that revolutionary Seldinger technique we mentioned comes in. The toolkit is surprisingly simple, really. You have a special needle to get into the blood vessel, a very thin, flexible guide wire to find the path, and then a catheter, which is just a tiny, hollow tube that will follow that wire and deliver the contrast agent right where it needs to be. So here's how this elegant technique works. First, the needle enters the vessel. Once they see blood flow, they know it's in the right spot. Then, the guide wire gets threaded through the needle. After that, the needle is slipped out, leaving just the wire behind. The catheter is then threaded over that wire and navigated up to the target area, usually with a live X-ray guiding the way. Finally, the guide wire comes out, leaving the catheter perfectly placed to deliver the dye. It's just a brilliant and really minimally invasive process. Now, doctors can't just enter this highway anywhere. They use very specific on-ramps. The most common one, the preferred site, is the large femoral artery down in the groin, and that's mainly because it's big and relatively easy to access. So, understanding the technique is one thing, but what does this whole process actually look like for a patient? Let's walk through the preparation and what happens after the procedure. Preparation is just key. A full medical history is taken, paying really close attention to any allergies, especially to iodine, which is in the contrast dye. The patient usually fasts for a bit, but they're kept well hydrated to help protect their kidneys. And of course, everything is explained in detail so the patient can give informed consent. After it's all done, the catheter is removed and firm pressure is applied to the puncture site to prevent any bleeding. The patient then has to be on bed rest for at least 4 hours, while nurses keep a close eye on their vital signs and check the circulation in the limb they used for access, just making sure everything is getting back to normal. Now, like any medical procedure, angiography isn't without risk. Complications can happen, things like bleeding at the puncture site, or a thrombus, that's a blood clot forming, or even an embolus, which is when a piece of plaque gets dislodged. Now, these aren't common, but it is exactly why patient selection and that careful post-procedure monitoring are so important. And this quote just sums it all up perfectly. The whole goal is to create a vascular roadmap. With that map in hand, doctors can pinpoint problems with incredible accuracy, whether it's an aneurysm, a blockage, or something else, and then figure out the absolute best way to treat it. Angiography completely transformed how we understand and treat diseases of our blood vessels. It's a huge testament to medical innovation. But, it makes you wonder. As technology like CT and MRI angiography keeps getting better and better, what will the vascular roadmaps of the future look like? What else will we be able to see? It's pretty exciting to think about.